Native TV presents Maternity Voices.
I'm not only holding a degree in medicine and surgery, but soon, actually in a month's time, God willing, I may graduate as a specialist in obstetrics and gynecology. And as a specialist, honestly, I cannot whatsoever lie you that these people are of a very great value when it actually comes to delivering mothers. Delivery of a mother is too technical to handle by a lay person because there are a lot of complications that may arise. Actually, some of these people who succeed in whatever they do is merely by God's grace. Let me assure you, by the way, namesake, even if you've never attended to any birth, if God decided that this birth will be perfectly good, indeed it will. But should anything minor happen, I can guarantee you that will count a life. So similarly, I do not want to convince you, neither would I want to be convinced that these people play a very big role when it comes to actually delivering these mothers. They honestly do it at the peril of the patient and the community. Their probable role would have been linking these mothers to facilities than actually doing the actual. Because I can challenge you and them, even if I ask them to tell me what we examine for practically, I think out of 100 I will give them less than 5%. And that much I can guarantee you. So honestly, if you are doing what you don't know, what are the chances that you will give me the best results? So I honestly will not make any advocacy whatsoever, and I want to reiterate the fact that government was very right because it was on evidence that these people were so detrimental, and I can guarantee you that whichever successes we get out of TBAs is just by God's grace. I mean, it's like any other animal that delivers and supported, and it actually does deliver. Those are chances. But should there be any complication that costs it, I do not have any positive, really recommendation in the use of traditional birth attendant. Let me surprise you. One time I was in the village, actually in my own area. In the neighborhood, a TBA was attempting to deliver a mother. By God's grace, the baby actually came out. The placenta was just hanging in the vagina. They ran to my place that the placenta had been retained, just hanging there. But because it had not fallen out spontaneously to the ground as they usually expect, to them it was a retained placenta. Just imagine if it were actually retained placenta. So I mean, they cannot have that knowledge. This knowledge is gained out of training, and not only training for a year, for years. It takes years. It's something not very easy. I actually do part of the training of these of students at all levels. Surely it takes time. It needs a lot of theory. One must be having a lot of knowledge. Eventually be able to do the right thing in delivering. It's not, I mean, as cheap or as easy. So therefore, in the event we are advocating for improvement of maternal health, and in the event we are looking at a reduction of maternal mortality ratios to 70 and less by 2030, these people must not remain in our system offering such services. Otherwise, we shall be at a loss as a country. That much I can guarantee you.
Maternity Voices is brought to you by Native Voices International in collaboration with White Ribbon Alliance Uganda. Thanks to support from USAID through East-West Management. No woman should lose a life while bringing a life to this world. In Uganda, the high maternal mortality of 326 by 100,000 deaths is preventable if all necessary precaution is taken by, among other interventions, ensuring that all mothers make all the required 8 antenatal visits, have health facility-based delivery, are delivered by qualified and skilled health providers. Mothers are treated with dignity and respect, have access to health facilities. Health facilities are well equipped, hygienic with the necessary medical supplies. Health providers are respected, and mothers' consent is given before a procedure. For this to happen, we all have a role to play by exercising respectful maternity care, demanding for it, and creating awareness about it. Join us as a partner in the campaign to establish a respectful maternity care. You can start by liking this video, sharing it in your networks, and subscribing to the Native TV YouTube channel for updates on this campaign and other common good initiatives.